The Crumbling Foundation of American Medical Research, a deep dive into the Trump administration's cost-cutting measures. The Trump administration's relentless pursuit of cost-cutting measures has cast a long shadow over the American medical research system, triggering a crisis that extends far beyond mere budgetary constraints. This isn't simply about numbers on a spreadsheet. It's about the erosion of scientific progress, the jeopardizing of countless lives, and the chilling effect on the very foundation of medical innovation. The consequences are already devastating and promise to worsen dramatically. The situation is far more complex than a simple funding freeze. While courts have rightfully declared a government-wide funding freeze illegal, the administration has cleverly circumvented this legal hurdle through insidious tactics. Scientific meetings, legally mandated events crucial for collaboration and the dissemination of research findings, have been systematically canceled. Furthermore, the publication of forthcoming meetings in the Federal Register, another legally required step, has been deliberately delayed, creating a bottleneck that effectively halts the flow of crucial research funding. This calculated obstructionism is not an isolated incident. It's a strategic component of a broader assault on scientific institutions. The National Institutes of Health, NIH, boasting a staggering $48 billion budget, has become a prime target in the administration's cost-cutting crusade. The impact is widespread, affecting research across the spectrum, from the fight against pediatric cancer to the relentless pursuit of a cure for dementia. These aren't abstract academic pursuits. They are crucial endeavors aimed at alleviating immense human suffering. The timing of these draconian cuts is particularly egregious. They come on the heels of the administration's push to extend the 2017 tax cuts that overwhelmingly benefited the wealthy. The irony is palpable. While the wealthiest Americans reap the rewards of these tax breaks, vital research funding is slashed, leaving scientists scrambling to keep their projects afloat. The urgency of the situation is perhaps most acutely felt in Alzheimer's research. This devastating neurodegenerative disease currently afflicts 6.7 million Americans, a number projected to double by 2060. While often associated with aging, the Centers for Disease Control and Prevention, CDC, emphasizes that Alzheimer's is not a normal part of the aging process. The critical funding gap created by the administration's actions directly undermines the fight against this devastating illness. Adding fuel to the fire is the nomination of Dr. Jay Bhattacharya to head the NIH. A conservative figure who gained notoriety for his criticism of COVID-19 lockdown measures, Bhattacharya's confirmation hearing offered little reassurance. While he pledged to ensure researchers have the necessary resources, he skillfully avoided addressing the administration's blatant funding freeze and the resulting mass layoffs. This circumvention of direct accountability raises serious concerns about his commitment to the scientific integrity and the well-being of the NIH. Senator Tammy Baldwin, a Democrat from Wisconsin, succinctly captured the essence of the situation. Make no mistake, Donald Trump and Elon Musk are slashing research for Alzheimer's disease to give tax breaks to big corporations. Baldwin's statement, while pointed, reflects the growing outrage over the administration's actions. The initial public outcry did force a begrudging response from the administration. They began scheduling study sections and publishing in the Federal Register, fulfilling their legal obligations. However, this minimal concession merely masks a deeper problem. A secondary layer of peer review, involving advisory councils, remains significantly delayed, causing further chaos and jeopardizing grant renewals. The repercussions are immediate and devastating. Reports indicate that grant-making officers have canceled at least 16 active grants, with the expectation that hundreds more could face the same fate. The administration frames this as ending the tyranny of so-called diversity, equity, and inclusion policies. But in reality, it amounts to an ideological purge, prioritizing political agendas over scientific merit. Further exacerbating the situation is the administration's decision to rescind the Richardson waiver, a transparency policy in effect since 1971. This waiver mandated the Department of Health and Human Services to publish policy changes in the Federal Register. Its repeal signals a shift toward secrecy, directly contradicting Health Secretary Robert F. Kennedy Jr.'s promised radical transparency. This move has sent shockwaves through the private sector, research institutions, and the scientific community as a whole. The irony is not lost on many. The few research areas seemingly spared appear to align with Kennedy's interest in projects that advance human health and can't be patented by pharma. The cumulative effect of these actions is a systematic dismantling of the American medical research system. The loss of funding, the delays in grant processing, the cancellation of research projects, and the chilling effect on scientific collaboration are not isolated incidents. They represent a coordinated attack on the very fabric of scientific progress. The consequences extend far beyond the immediate financial losses. They represent a profound threat to the health and well-being of the American people, jeopardizing future medical breakthroughs and leaving countless patients vulnerable. This is not a matter of political maneuvering. It is a matter of life and death. The situation demands immediate action. The scientific community, along with concerned citizens, must unite to demand accountability and transparency from the administration. The future of medical research in America and the health of millions hangs precariously in the balance. We must act now before the damage becomes irreversible. Silence is not an option. It is complicity. The fight for the future of medical research begins now.